All right, thanks everyone. Again, just a few things. As I mentioned, let me just bring up the case presentation form I sent out to all of you. In most of our sessions, we are going to be able to do a case presentation. We encourage all of you to bring a case to us if you'd like to do that and present the case as well. I sent this form, which we asked that you bring back about 2 days in advance of the session. You send it back through email at survivorship@yale.edu, right here at the bottom of the form. If you have questions about filling out this presentation form, be happy to help you with that. Please just email or reach out and we'd be happy to help with that. Additionally, for the presentation itself, if you'd like to do a mock presentation, again, I'd be more than happy to run through that with you. Just please do give a little bit more time in advance than those 2 days if possible. All right, so with that said, we'll start with introductions. I'm going to stop sharing the screen here, go back to us. So I guess we should start here, introduce all of us. My name's Jevin. I'm the physician assistant with the Yale Survivorship program. Our icebreaker for today, let me just pull up our slides here. Okay, so that's all of us. And just some reminders. Our icebreaker today is going to be, what makes you interested in our survivorship echo? So we're going to go around and ask everyone that's here with us today about that as well. And again, just to show you how the session will go a little bit today. It's just a rough outline. We might deviate a little bit from that. All right, so let me just stop the share. Okay, so next we'll go right around the room. Angela, go ahead.
Hi, I'm Angela Corolla, and I'm the clinical social worker on the team.
You want to say why you're interested in ECHO?
Well, you didn't say
Oh,
why.
sorry, I didn't. You're right. You're right.
Go ahead.
I'll go. Okay, thanks. I'm interested in this echo because I think it's a wonderful opportunity to be able to, help share, the resources that we have, help educate others on survivorship care. And I think there's just a growing need across the nation about, with regards to cancer survivors and their unmet concerns. So I think it's important to be able to address that and then also highlight the multidisciplinary approach that we have as a clinic and how that's useful for cancer survivors.
And really, in all honesty, just echoing what Javin had just described, but I think really for me, it's the multidisciplinary approach that we have here as our team. It really is the best practice for meeting the needs of cancer survivors.
Hi, I'm Scott Capoza. I'm the physical therapist part of the survivorship team. I've been here since the clinic was created in 2006. And I can tell you that, over all these years and for us as a team to have gone to the different conferences and to have gone and talked with other providers around the country about what they're doing for survivorship care, we truly realize that this multidisciplinary approach is a very unique model. And by addressing the needs of the survivor from multiple facets, we truly get the full picture of who our survivor is and how we can meet their needs. So that's why I am proud to be a member of this team, and that's why I'm excited to be a part of this ECHO project to continue to get the word out about how we practice survivorship here at Smilo.
Well said. So hi, I'm Maura Harrigan. I'm the dietitian here, and I've also been here since the beginning, a few months after Scott, so since 2006. As a dietitian, working with survivors, it's such an important component of their care, and they have so much interest in nutrition and so much misinformation and confusion that it's really meaningful work to address their nutrition concerns and help them do better in terms of managing their survivorship journey. And the beauty of having a multidisciplinary team really helps, because when I'm with them, I can really focus on nutrition. And when they bring up other concerns, I say, well, you're going to see Scott for that, for your exercise questions, or you're going to see Angela. or other concerns. So it helps me be able to stay very focused with them on nutrition and make a very effective session.
Great. And I'm Tara Sampt. I'm excited for this. I have to give my team a lot of credit. They had heard a grand rounds, I guess over a year ago now, about echoes, and they came and they said, we want to do this. And I have to give Jevin particular credit for, really making sure that this thing took off. So you're here witnessing the first one. I've been here since 2010. I'm the director of the clinic. I'm also a breast medical oncologist. I'm also board certified in hospice and palliative medicine. And to me, what I love about ECHO, and hopefully, we can start to brainstorm how we can do this, but I'm very passionate about messaging and how we talk to patients and the words that we use. And I'm hoping that what we can do in a platform like this is agree on some sets of messages that would be our signature of care, so that wherever you are in the network, if you have a basic question, what should I do about this, that we can all agree on some baseline levels of counseling that are, evidence-based and something that we all agree on. What I find is that there's some, old wives' tales that we hear in clinic or that I hear from my patients that are out there, and I want the opportunity to discuss those and to agree on some messages that are based in evidence and that our patients, really need to hear.
All right. Well, thanks everyone. Thanks, Tara, for the amazing words. Very kind of you to say. Thank you. And
you guys have done so much work on this, so we're really excited.
yeah, it wouldn't be possible without everyone here. And thank you all for joining. You are as equally a part of this as all of us. Yes. Yep. I wanted to give you all a chance to introduce yourselves as well. I'm going to go ahead and mute us, and we'll start with Lisa on the video today. Lisa, go ahead and unmute and introduce yourself and whoever else is there with you.
Good morning. I'm Lisa Hoffer, the nurse practitioner in radiation oncology, and it's good to see faces to go with names that I've communicated with on InBasket. I'm excited about this because as a care center, we see patients in long-term follow-up, especially certain kinds of patients like head and neck patients. And it's good to have an opportunity to have this scripting and this messaging and have the resources, because not all our patients feel comfortable traveling to other locations to be able to get services. And I'm here with my attending.
Hi, my name is Christian Jethro. I'm a physician in radiation oncology. Actually, a relatively new addition to the group. I joined in July. I have a pretty active and a strong belief in holistic and multidisciplinary approach to active care and surveillance care. And I think this ECHO will be a really great resource for us providers to learn from each other, brainstorm together such that we can improve our long-term care of patients. And it's nice to know the resources within the Yale system so that if I do have a question about a follow-up patient who needs some added assistance, I know who to reach out to. So I'm happy to be here, and thanks for having us.
Absolutely. Thank you. Great answers. And yes, we're happy to field any questions you have. Reach out anytime. Be happy to help you. Okay, so next it looks like we have Suzanne on the phone. Suzanne, if you can unmute yourself. Okay. Suzanne, you can just.
Can you hear me?
Yes, perfect.
Okay. So I'm representing the Guilford Care Center today, and unfortunately 2 of our nurses could not be here. Oops, I'm going to hit unmute. Hold on. Okay. Actually, I hear an echo. Speaking of echo, I hear an echo in my computer. Sorry.
Let me lower our volume a little bit here. Hang on 1 second.
Okay. Hello? Okay. I'm still having the same problem.
Okay. Yeah, we can hear you. Maybe lowering your volume a little bit might help.
Okay.
Suzanne, are you on the screen and on your phone?
Right, my mute is, I cannot, I can see you guys, but I cannot, my device is, the speaker is not working
Okay,
on the computer.
okay.
Okay, we
So,
can,
We
this is
don't
a little
hear an
awkward,
echo.
sorry.
It's okay.
no,
Karen Brinkman, Orange.
Oh, hi, 1 second. Suzanne, can you still tell us a little bit about
My
Echo?
interests,
Yeah,
yeah,
your
so I've been working in a care center now for a couple of years, and I see the need for education and support for patients, families, and staff to transition to survivorship. So when the ECHO program came out to Guilford, I thought it was interesting, and also I'm interested in working with my colleagues, 2 nurses, to develop, you know, their understanding as well. So I've been with oncology now for a number of years, and I've watched the development of the Yale Cancer Center and Smilo over the years. So I see the development also in survivorship, you know, as a program. And so I'm very happy to be here. Sorry, this sounds a bit disjointed because again, I'm hearing an echo.
no, that's quite all right. And thank you, Suzanne. Appreciate
Okay,
you being able to join us this morning. And
yep,
thanks
thank
for
you.
letting us know a little bit about where you're at and the need you see for cancer survivors.
Yeah.
All right. So next, we have another number here. A few others have joined us. We have 203-795 795-1664.
Yep, it's Joe LaSala.
Oh, hi, how are you?
Joe.
Hi, Joe.
Hey. Hey,
Joe,
I'm sorry, I can't get online.
oh, okay.
I can't
So-
access Zoom. It doesn't take any of my usernames or passwords that I know.
Okay, no problem. We know the struggle. So, Joe, we're just asking that you introduce yourself, tell us where you're coming from and your role, and what makes you interested in the Yale Cancer Survivorship ECHO.
So I'm a medical oncologist and the medical director in the Orange Care Center. And we are fortunate to have the survivorship team come to our office every other week, 1 day a week. So we're able to sort of witness that firsthand and sort of see what they do. And certainly we'd like to expand that in our office and be able to offer that service every day to our patients.
Yes, and we have the pleasure of seeing you every time we come to Orange as well.
Thank you for having us.
Yes,
thank
thank
you
you
for
for having us. Absolutely, and thank you for letting us know what makes you interested. All right, and then I think lastly, was that the?
One on the bottom.
We
I
have
think
a
that
two.
one is,
Was that Suzanne?
I think that's Suzanne.
Okay,
Yeah.
I think it was Suzanne as well.
There's one on the bottom.
Yeah, she's on the
She's-
screen and on the
Oh,
phone.
okay.
Okay, so
unless, is there anyone else who hasn't talked yet? You can unmute yourself.
okay. So I think we've gotten everyone. Just as a reminder, if you are on the phone, you can mute and unmute using *6. And if you have a question or concern, raise your hand is *9. For questions, concerns, or comments, you can also use the chat at the bottom of the screen if you are on Zoom by video as well. With that, we'll get started on our presentation for today. We're going to be starting with some of the basics on survivorship with Survivorship 101. I'm going to share the screen here. Bear with me 1 second. Okay. Okay, so let me just jump ahead here. So we are going to start, like I said, with Survivorship 101. There's all of us. You already know us from just seeing us here today. The only person in this picture who unfortunately could not be here with us today is in the middle there, Angelique Williams. She goes by Kiki. She's our wonderful program coordinator. She's on the front lines helping to recruit survivors to come to see us in clinic. She does a great job, and we definitely miss her presence here today. Just to get started, there are no financial disclosures for this presentation. Some objectives for today's session, you're going to learn about the definition of a cancer survivor and cancer survivorship, about some statistics on survivorship, the different phases of survivorship that we consider, some of the concerns facing cancer survivors, and the multidisciplinary approach to cancer survivorship. So starting with the definition of a cancer survivor, a survivor is anyone who's been diagnosed with cancer from the time of diagnosis through the balance of the rest of his or her life. And in survivorship, we focus on a number of concerns that might be unmet from the survivor. Things like physical symptoms from late and long-term effects, psychosocial concerns such as mental health, fear of recurrence, spiritual concerns, financial concerns, healthy lifestyle recommendations with exercise and nutrition, and also guidelines for surveillance, cancer surveillance, and watching for any recurrence of their own diagnosis as well. And really, the goal of all of this in the clinic is to help empower the patient. I wanted to just show this to highlight the need for survivorship care. And as you can see, it's been a growing need since '75, projected up to 2040. At current, as it stands, we're at about 19 million cancer survivors in the United States. And by 2040, it's projected to be over 26 million. And it's really a twofold increase. We see on the front end of things, we have better treatments, better outcomes, more cancer survivors. And then on the back end, we have survivors living longer lives. Not to mention, we also have an aging population that's contributing to the growth of our survivor community. So you might be asking where all this started. This started back in 2005. We can trace back to when Lost in Transition was published by for the Institute of Medicine. And really it highlighted the fact that there was a focus on surveillance, but there really wasn't much in way of survivorship care itself, meeting these needs of cancer survivors. So the goals were to help develop standards and best practice guidelines for this, and to help generate communication between oncology, primary care providers, and other providers to help provide care for survivors, and also to foster survivorship research as well. So next I want to talk a little bit about the way we think about survivorship and some of the phases involved with it. First, we think about the acute phase of survivorship, where we're talking about when cancer patients are first diagnosed, when they're told what treatment they're going to be needing, and that conversation is had. And oftentimes at this point in time, this is all they can think about. It consumes them with, my gosh, I have cancer. My gosh, this is the treatment I'm going to need. How am I going to pay for that treatment? Will this treatment work? What are the side effects from treatment? And so on. And a lot of the expectations that are told to them are often missed at this point in time. And that's where what we also consider in a survivorship clinic, addressing some of these concerns that might have been missed early on, and talking about the long-term follow-up as well. And then into the extended phase of survivorship, we start thinking about life after treatment. Once a cancer survivor has gone through active treatment, they're dealing with a number of concerns still, from late effects from treatment, maybe fear of recurrence as well. As you can see from the picture here, again, it's almost like they're waiting for something to happen. That shark is catching up to the kayaker there. Doesn't look like a great situation. And then, again, some of the late concerns, thinking things like peripheral neuropathy and lymphedema and so on. Mental health concerns with anxiety or depression. How has life changed for them through their treatment and beyond, with their home life, relationships, finances, job-related concerns, and maybe even their body image. Maybe they've had a mastectomy. Maybe they've had an excision of a soft tissue sarcoma, and they're thinking about, well, I don't look like how I did. How do I deal with that? On the flip side of it, they might be thinking, I got through this pretty well. They might deal with post-survivor's guilt, or they might be having issues with how others view them now, one way or the other. And then we think about the long-term phase of survivorship, where now they've gone past that 5 years and they're dealing with life after maybe being discharged from their oncology team back to primary care, dealing with a lot of these concerns still, perhaps, and how that affects their life at this point in time. And how are they going to still be appropriately monitored for recurrence? So I want to take a break here. I know that was a little bit of information right there, and I want to check in with all of you. Let me ask you, how have some of the concerns that you've seen from cancer patients and then survivors, how have they changed? Starting in the acute phase and through the extended phase and maybe into long-term follow-up. I'm going to stop the share here so I can see all of you again. And again, feel free to unmute yourself and raise your hand, let us know, or unmute and just start talking. Or if there are any questions that you had about any of that so far. Maybe, okay, maybe we have a comment here. Maura, go ahead.
Yeah, I'd like to say that in survivorship, you saw those phases. But what we find is, as people move through those phases, their needs change and their concerns change. So it's kind of an evolving process. So in survivorship, it's important for us to know, how far from diagnosis are they? Are they just out of active treatment? That's a whole other set of concerns. Or is it 5 years out? Or is it 10 years out? And from a nutrition perspective, their concerns change. And what stage of life are they in? Are they a young adult? Are they concerned about fertility? Are they a young mother with small children? What phase of life they're in? And that is all folded into the nutrition counseling. So I just want to point that out.
And not to mention, what's unique about our clinic is that we've actually had the opportunity to see patients, right? I started in this clinic over 6 years ago, and there were patients who we saw at that time, and they identified needs, and then 4, 5, 6 years later, their needs have changed. And so it's amazing to see actually and experience that with patients, and to be able to just be where they're at and help them at that phase of survivorship.
And there is something we do, I think, very effectively as a clinic, is that we ask the patient to state their 2 primary concerns when they arrive. And that really directs our counseling. So it may, that their 2 primary concerns can be very different from their cancer, how they present with their cancer diagnosis, in terms of type, stage, treatment. Their concerns could be financial, right? Or, housing, or, exercise. So it's emotional. So it's very important to get from the patient, why are you here? And so then we better address.
Yeah, I mean, I think also just to hop in is we see most of the patients in that extended phase. So after active treatment has ended and they're feeling kind of lost in transition. That's why this clinic was started. It was started by a survivor who said, I wish I had had this, at the time that I was going through treatment. We do see long-term patients as well, but we don't follow people on an annual basis. So people find us when they're ready. That's sort of how I think about it. And occasionally that is a decade out, sometimes many decades out. We see everyone. So, but the vast majority of people that we see are in that post-active treatment phase where they're kind of getting back to where they want to be.
And thank you, Tara. Thanks, Maura, and thanks, Angela, for those comments. Really appreciate that. And just also, since I've started here, I also work with Tara and breast oncology as well. And I think it's amazing seeing, survivors go from active treatment into the survivorship phase and long-term follow-up. And sometimes we'll see them also in survivorship clinic, our own patients. And, that there is this transition where they're thinking, well, why do I feel this way still? I just had treatment and I completed it. I shouldn't feel like this. And it's about really fostering that emotion that they're feeling and normalizing it. That's so important.
And Jeff, I'm just going to go off the top of my head. I think one of the many things that we do in survivorship that I think we can do for our survivors at any point during their trajectory is validation. Like you just said, somebody finishes chemotherapy and 6 months later they're still fatigued, or they're still having a tough time entering the workforce, and they don't understand why, because their active treatments are actually done. So for our patients that we see in survivorship, we validate that and say that these are normal experiences that you're going through physically, emotionally. These are normal responses to your cancer treatment, and then we give them the tools to help move forward from there.
Absolutely. Thanks, Scott. Appreciate it. And it does look like we have Kelsey Martin who's joined us. Kelsey, I'm going to ask that you unmute yourself just quickly and introduce yourself. Let us know who you are, your role, and where you're coming from.
Sure. Can you hear me okay? Okay. Kelsey Martin, I'm at the Orange Care Center.
Okay, great. And Kelsey, tell us a little bit about why you're interested in our survivorship backup.
Yeah, I mean, I want to learn more about the mechanisms. I know we had that talk the other day, and I'll be honest, I heard it, but I couldn't remember some of the nuances of how the program works. And so I'm a big fan of survivorship and trying to get it into the conversation with our patients. So, but I wanted to refresh my memory of sort of how the program works. That's all.
Great, and thank you.
Segue back to your slides.
Yeah, that is a perfect segue. Well done. All right, thanks, Kelsey. And again, just a reminder to everyone here, if you're joining us, you can also enter your name into the chat as well. Just remember to mute yourselves before we get back here too. So, did anyone have any other questions, comments, or anything they wanted to share? Okay, so we will get back to the slides. Let me just jump back in. Okay, so we were just finishing up on the phases of survivorship. Next, I just wanted to briefly touch on some of the tenets of survivorship care, talking first about cancer surveillance. And this is something that we consider as well when counseling patients in survivorship clinic, talking about ways to manage their screening with colonoscopies, for example, pap smears, and so on, as well as following up on their own care with regards to their diagnosis. Helping them to identify and treat late and long-term effects from their active treatment. So sometimes survivors will come into the clinic and they won't even know that they're having a certain side effect from their treatment. And we'll be, asking them, oh, and do you have this? Yes. Oh, I never knew this could be related to the treatment I had. And so it's important to screen for some of these late effects. And then counseling on the treatment of them as well. Health promotion is another topic that we discuss with survivors, discussing lifestyle interventions, again, with nutrition, exercise, mental health and well-being. And then we also discuss coordination of care. It can be overwhelming at times for survivors to deal with all the follow-ups they need, whether it's physical therapy or to another specialist or so on. And so it's important to be able to help them know who they need to be seeing and help direct them in that way as well. One of the things that we use in our survivorship clinic is the survivorship care plan. And the goal of the care plan is to help empower patients with a guideline for, with some information about their diagnosis, their treatment, and then follow-up recommendations. But is it really enough to just hand them a document and say, well, you're good to go, here are some instructions? And the short of it is no. Cancer survivors have almost unanimously said it's helpful to have a face-to-face explanation with this. And oftentimes during that explanation and during that visit, they're going to talk about a lot of needs that they might have, from things like fear of recurrence, care coordination, as I mentioned before, quality of life issues. And unfortunately, cancer survivors are often missing the care they need for these unmet concerns. And so that conversation is really important to supplement survivorship care. So I mentioned some of the issues there on that slide, but I want to get into a few more of the concerns that survivors come to us with. For chemotherapy, some of the things that we think about, peripheral neuropathy, cognitive issues, bone loss, sexual dysfunction. And then with surgery, post-surgical pain, cosmetic defects, radiation, maybe lymphedema, radiation fibrosis, secondary malignancies. And then there is going to be common ground amongst all of them, from things like fatigue and pain, fear of recurrence, anxiety, depression, weight changes, deconditioning, poor sleep, and so on. And then again, just to highlight the scope of concerns here, how many there are. They can even be broken down into subsets and have different symptoms within each, or concerns within each, from sleep and energy to mood changes to menopausal symptoms, changes in appearance, dry mouth, and so on. So just to give you an idea of some of that breakdown. And then I wanted to touch on some of the late effects and lifestyle considerations a little more specifically, some of the bigger ones that we see very common amongst cancer survivors. Hint, hint, a little Easter egg here for sessions coming up in the future as well. So first, fear of recurrence is a very common concern. Reported up to 70% of cancer survivors have this concern, and it's the #1 unmet concern that survivors have. Fatigue is shown to be experienced by 80% of those who receive chemotherapy and or radiation therapy, and it can last at least even up to a year following treatment. Lifestyle considerations are a big unmet concern with survivors, and oftentimes they're looking to better their overall lifestyle. Things like inactivity, being overweight, poor diet, and it can be beneficial in a number of ways as well for overall health and fitness, of course, but also symptom management and reducing risk of recurrence and mortality. And then sexual dysfunction can affect both men and women with pelvic malignancies or other cancers. And the 2010 Livestrong survey showed over 3,000 people having sexual dysfunction and was listed as the 3rd most reported concern. And despite this, less than half received medical care for it. And then secondary malignancies, though they're uncommon, they are possible. And in about 8.1% of survivors, they've developed secondary malignancies. And then peripheral neuropathy. And then, this ranges from the acute phase where they're inactive treatment all the way through long-term follow-up, where 19 to 85% can have peripheral neuropathy, and it can lead to permanent symptoms in up to 40% of cancer survivors. And then lastly, I wanted to mention lymphedema, and it's reported again from that Livestrong survey that out of 14 million survivors at that time, 20% of them included lymphedema as a physical concern as well. So no small numbers there. So I wanted to pause here as well and get some feedback from all of you and ask, what concerns have you seen that have been the most prevalent in your practice? And feel free again to unmute, raise your hand, let us know who you are, and let us know what you have to say.
Oh, hi, this is Joe.
Hi, yes, thank you, go ahead.
So I would say the quandary that patients have is that they just don't know what their symptoms mean. They don't know if they should be worried or not, or when they should be worried, or what they should be looking for. And I think that's the sort of the repeated question each time, some interim visits for that, and it has to do with the anxiety of concern of relapse.
Absolutely. Thanks, Joe, for that. And so again, it sounds like the concern there is the concern over these symptoms that might be happening and maybe some fear of recurrence that's going along with some of these symptoms and the fear of relapse from them. And so I know when counseling survivors, one thing that we review in the care plan is really highlighting the fact that anything new that's presenting, something that's not getting better with more conservative management, is reason to reach out to one of their care team members for further workup. And then being able to review some of the symptoms of recurrence that they might experience. And just as a launching point, maybe some of
Yeah, I completely agree with what Joe says. This rings true to my practice too. You know, for instance, in breast, it's post-mastectomy pain that we see quite a bit, and they may have been told about it up front. You know, it may have been talked about a little bit, but until it happens to them, they hadn't thought about it, and now all of a sudden they're coming in with concerns about it, and they don't know if it represents something or not. And I think those are all very good points. And Joe, you know, we know what we're concerned about, but patients don't always know like what their new normal is. So, you know, hopefully during this echo we can talk about that at different points and how we can frame that to lessen the anxiety.
Sorry. Another, I think in a similar pathway, something that I struggle with discussing with patients is particularly the patients that have been on 10 years of an aromatase inhibitor. And as that is discontinued, I think there's a lot of anxiety surrounding breast cancer recurrence. And then I think in addition to that is for the hormone receptor positive, ERPR positive patients, sort of that natural history where there is still a risk of recurrence 10, 15, 20 years later, you know, many years later. And how do you explain that to patients without providing tremendous anxiety? And so.
Those are great points. I'm curious about the Hamden group. If you said you have a large head and neck population there too.
Yeah, so I mostly specialize in head and neck and GI cancers, and of those disease sites, probably the most common things people bring up to me are, number one, fear of recurrence. Second most common are the long-term severe morbidity. So for the lower GI cancers, almost all ask me about long-term continence or managing a colostomy. What will their bowel function be long-term? For head and neck cancers, it's usually xerostomia, that's the dry mouth, that's the main issue that people have long-term amongst all the things that people have with head and neck cancers. It's swallowing dysfunction and xerostomia that I think people complain about the most. Occasionally it's a neuropathy like shoulder dysfunction, chronic shoulder pain, or accessory nerve dysfunction can be problematic. Lymphedema, a little bit less so, but sometimes people have severe lymphedema following surgical resection.
And I would definitely say that with the head and neck population, the long term in terms of dental care, if patients haven't had all their extractions, you know, years and years out, we're getting contacted by dentists about, is it safe to do a certain procedure, and just reminding patients every visit, always check in with us and things like that. So the head and neck population, I think, is different from what we've discussed so far, the breast. So we see those, and we see a lot of prostate patients too. And the men have lots of sexual concerns, especially if they've been treated with androgen deprivation therapies.
Yeah, I think the head and neck population is really interesting because we put them through such brutal treatment up front, and managing the acute toxicities is so tough. And I think it hardens patients in that they have so many long-term side effects, but the only things they really complain about are they have to carry a water bottle because their mouth is dry. But I examine them and I see a whole host of long-term toxicities that I think go undermanaged, but the patients are so tough after all the treatment we put them through that all they complain about is dry mouth. So I think we can help them a lot. They just don't recognize the side effects they're dealing with each and every day.
I'd like to comment towards that.
Yeah, go ahead, Maura.
Yeah, so I agree. The head and neck, we get head and neck patients to clinic. I'd like to see more of them. The challenge is to continue to nourish them despite these side effects of dry mouth, difficulty swallowing. And so I spend a lot of time helping them modify the textures of their food, give them recipes, give them ideas of, so that they can still capture all their nutrients, but in textures that are easy to tolerate for them. And that's often a huge transition for them, because they usually come in on a very limited regimen of foods they can tolerate, and they're lacking, you know, it's lacking nutrient density. So I try to expand that for them, and it's usually welcomed. And the other thing is ostomy care, how to eat, what foods to eat that are manageable with an ostomy in terms of smell, gas, that type of thing. So, and how to manage it out in public. And so there's a lot of that counseling too. So it's very welcomed by patients.
And I'd like to dovetail off of that too. And I don't want to let the cat out of the bag with our case study that we might get to today or in the future. But again, for the head and neck population, to really reinforce with them range of motion, to really be on top of keeping their musculature strong, to make sure that for them to be able to do range of motion exercises really needs to be a daily occurrence to try to stave off some of the long-term effects of radiation fibrosis syndrome, and just reinforcing with them, point after point to say, no, you can't necessarily stop your exercises a year out or 2 years out. So that to instill in them that this is going to become part of their really their self-care moving forward.
I love this discussion, and this is what I love about the multidisciplinary clinic is you get to see breast cancer on one side, and for each of these specialties, like the host of concerns are really on this end, and then it's kind of way over on the other spectrum, the head and neck cancer patients, and they have, again, nutritional activity, fear of recurrence concerns, but it's really on another extreme. And I, as a provider who participates in this, it's really interesting to see how related they are, but on such different ends of the spectrum. So thank you for bringing this up. This couldn't have been planned better.
Yeah, no.
So look, maybe we should finish our slides because we're just about 10 minutes from ending.
Oh, absolutely.
Yeah.
Thank you. Yeah, so we're going to jump back to the slides. Thank you, everyone, for the wonderful discussion there. I'm going to jump back into the slides here. Bear with me one moment. Okay, so we left off on some of the late effects we were talking about. Just to quickly highlight what we do here in our survivorship clinic. As I mentioned, we are a multidisciplinary clinic, and there are some great advantages to the multidisciplinary approach. Again, you have a group of experts that can speak to some of the long-term late effects from treatments, from different diagnoses and treatments that were received. Multiple services are provided in one location, so it's sort of like one-stop shopping, and survivors find that very convenient. And it's a great model for complex patients because, again, as you can tell just from hearing some of us speak today, there's great utility to having each discipline available to address even one issue, and how that issue can be so multimodal and multifactorial. And again, Kara so wonderfully gave us an overview of, or quick, brief explanation of how the clinic started by a survivor, but it was established in 2006. We do have 30-minute visits with each of us for a 2-hour visit total, one-on-one with each of us, and it's purely consultative. There's an initial visit that we offer and an 8-week follow-up that we offer as well. And survivors are welcome to come back after that as needed. And every survivor at the time receives an individualized care plan. So I did want to give each of us just a brief opportunity to highlight our roles in the clinic. And Kara, happy to start with you.
Thanks. So as the medical providers, and Jevin, you can chime in this too, we go over basically the diagnosis and the treatments and the plan going forward. So we're giving the actual paper survivorship care plan. And it's interesting to see as you go through line by line, how much questions there are about the diagnosis, and a lot of confusion about the stage versus the grade, and even even such simple questions like, what is tamoxifen again? Like, what is the estrogen receptor? That the patients have heard this before. They had such information overload. So it's a really nice opportunity for us as providers to just go over what we already know and just basically clarify some things that we don't normally take the time to do in our average follow-up clinic. The other thing I wanted to say about the medical piece is it's really based in patient-centered communication. So we're meeting the patients where they are, and that includes the medical portion of it. So there are times where they don't even want to talk about their diagnosis or the treatments. All they want to talk about is this one side effect that they're still dealing with. Or some patients relive the whole experience, and for that half hour, they just really want to go over again all of the things that they've been through. And so it took me a while as a doctor to get used to this, but you know, just letting the patient take the lead, it actually ends up being very satisfying. And so I have a name for it now, and it's really patient-centered communication and meeting them where they are, just kind of letting it be what it is. So I don't know, that's my 2 cents on that.
I completely agree, and just to jump off of when we're reviewing the care plan, it really highlights again what Tara was saying, those expectations that are missed oftentimes, you know, when they're in active treatment or in those follow-up appointments, that again, when you're going over it, they're like, oh, you know, I don't remember this, or what does this mean again? And so being able to go over that with them again is really rewarding for them, and again, it empowers them to be able to have that motivation to, you know, live the life they want to be living moving forward. With that, we'll move along to Angela, talking a little bit about the psychosocial concerns, our social worker.
So when I meet with patients, again, it's really starting where the patient is at. It's so important to provide them with an opportunity to really talk about how they're doing emotionally with regards to their cancer diagnosis and treatment. When I meet with patients, they're not only dealing with the fact that they had cancer, but also the impact that cancer and cancer treatment has had and may even still continue to have on the rest of their lives. And so cancer and cancer treatment impacts all aspects of a survivor's life, socially, emotionally, spiritually, financially, sexually, and quite often their lives have been knocked out of balance. So it's really providing them with that opportunity to talk about how can they get things back on track in order to move forward. So really just starting where the patient is at, emphasizing that how they're thinking and how they're feeling is very normal, and that other cancer survivors also think and feel the same way that they do. Some of the common themes that I will see in clinic, fear of cancer recurrence, we have mentioned this multiple times this morning, and I have to say from my perspective, that is something that comes up pretty much with every single cancer survivor. It's very rare that I will meet a survivor that isn't having some level of fear of cancer recurrence. Part of my job would then be to assess, is this truly an anxiety or depressive disorder, or is this normal to be having some level of this? And we will talk more about that at a future echo. But really, financial information comes up, relationship issues, you know, sexual issues. Quite often patients will say to me, wow, this is the first time I'm actually talking about how, you know, cancer's affected me sexually. And then concerns with purpose and meaning are also quite common for me, so.
All right, thank you, Angela. Next, we're gonna have Maura talk a little bit about her role as a dietitian.
Okay, so one of the primary concerns is weight management. And it's all ends of the spectrum though, from head and neck that have significant weight loss to the other end where we have breast cancer patients often with significant weight gain. So it's both ends of the spectrum. So that's what I call weight management. A lot of times I'm reframing weight goals for patients. What's realistic, either in terms of weight gain or weight loss. And I really evaluate it in terms of weight change over time. You know, percent of weight change over time. And that helps people get more realistic goals and attainable goals, either for weight gain, which you think weight loss is hard, regaining weight is very hard. And also, I don't like using BMI. People come in with these hard and fast numbers that they need to be at based on BMI, and I have to spend a lot of time undoing that. Here's a word cloud I created with all the concerns that people come in, nutrition concerns. You can see it runs the gamut. And I spend a lot of time sifting through their concerns, which are often based in fear of recurrence. And there's a lot of misinformation out there. So again, I spend time sorting through that with the patient. And often that fear of recurrence leads to overusage of supplements. People think that oftentimes they come in and ask me, well, what supplements should I be taking? and what foods should I not be eating? And it should really be the reverse. What foods should I be eating? And there's very little need for supplements. So kind of clearing that up, because the myth is out there that more is better. And believe me, people will take a lot of supplements in a high dosage. So I sort through that with them, and always looking for first do no harm and make sure there's no interaction with the medications that they're on.
All right, thanks, Maura. So next we'll have Scott, our physical therapist, talk a little bit about his role in the clinic.
Yeah, so my role in the clinic really serves a couple purposes. First and foremost, to check in with everybody and see how they're doing as far as their overall physical activity is concerned. Taking the national guidelines from the American College of Sports Medicine, as far as all survivors trying to exercise 150 minutes a week. But again, as everybody has said before me, meeting the patient where they are, that can be a big number for somebody who has not been exercising before. But for a lot of our survivors, they realize that after a cancer diagnosis, they want to be healthy, they want to know how to exercise, but they don't know how to exercise. And so to be able to sit down and talk with them and figure out what do they like to do and how are they going to infuse that into their daily lives. And then more specifically honing in on the needs of more the physical needs. As a physical therapist, I can screen for range of motion, strength, loss of balance, any kind of scar tissue management. If anybody is experiencing lymphedema, we can make those referrals to any of our amazing lymphedema therapists throughout our network. And also just to let you all know that the American Physical Therapy Association finally has board certification for oncology PTs. I am fortunate enough to be one of those, and it's our hope that we continue to grow that number so that if you need to make referrals for physical therapy, that you can be searching for board certified PTs.
All right, thanks, Scott, and thank you everyone for sharing a little bit about role in the clinic. I just wanted to get to one more point before we wrap up today. Just to dovetail off of everything we've talked about, something that we all do as providers in our survivorship clinic is highlight the teachable moment. And we really want to make sure we're taking advantage of this with survivors. At this point in time, after having gone through the journey with cancer that they become very malleable at this point, and they're seeking to actually better their overall lifestyle. And it's important to know that healthcare professionals can significantly influence promoting these healthy lifestyle behaviors and survivors adopting these. Less than 25% of oncologists, though, provide health promotion counseling to their patients, and less than 10% of survivors report even being asked about things like diet and exercise. So it's important to utilize this time in a survivorship visit to be able to talk to survivors about this and help empower them to take advantage of this. So in summary, I just want to recap what we've talked about today. Our cancer survivors include anyone diagnosed with cancer, and survivorship focuses on the health and life of a person with cancer post-treatment until the end of life. The number of cancer survivors in the United States continues to rise, highlighting the need for care with a strong effort to address this nationally. Cancer survivors have several unmet concerns that may include psychosocial issues, physical symptoms, and long-term effects. A multidisciplinary approach to survivorship care helps to address these needs. It is important to capitalize on the teachable moment. All right, thank you everyone for taking the time to join us for today's presentation and session, the discussion, and just leaving you with a healing image on this beautiful Friday of our healing garden here at Smile Up Cancer Hospital. With that, I'm not sure, we have about a minute or so.
Why don't you talk about our next echo and what we're probably gonna do, and you can stop sharing the slides.
Yes. So where we only have a minute left, we're gonna jump into just a few reminders for next time. Again, I will send an email following up with this with the post-session survey about today's session. If you have any questions, feel free to send an email along as well to survivorship@yale.edu. Also, I will also remind you about the case presentation form. We didn't get a chance to get to ours today, but we will in the future. If you do want to present a case in the future, I encourage you to let us know. Send along the form completed, or if you need help with it, to survivorship@yale.edu and let us know about that. Happy to do a mock presentation with you as well. And again, thank you all for joining us today. Our next session will be on October 25th, Friday again, same bat time, same bat channel, here 8 a.m. to 9 a.m. Thank you everyone for joining us today. Take care.
Thank you.
Thank you.
Thank you. Bye.
Leave meeting, right? Leave meeting.